Antiplatelet medications, mechanisms, clinical applications, and therapeutic outcomes. Antiplatelet drugs represent a critical pharmacological class that prevents blood clot formation in arterial vessels. These agents work through distinct mechanisms to inhibit platelet aggregation and are essential in managing cardiovascular and cerebrovascular diseases. Understanding antiplatelet drugs and their role in modern medicine. Antiplatelet medications constitute a fundamental class of pharmaceutical agents designed to prevent the dangerous clumping of blood cells that leads to clot formation within blood vessels. These drugs are particularly valuable in treating and preventing conditions affecting the arterial circulation, where traditional anticoagulant approaches have limited effectiveness. Unlike some other blood-thinning medications that work through different pathways, antiplatelet agents specifically target the mechanisms that allow platelets to stick together and form obstructive clots. This distinction is crucial because arterial clots, which cause heart attacks and strokes, behave differently from venous clots, requiring specialized treatment strategies. Distinguishing features of antiplatelet therapy. What makes antiplatelet medications unique compared to other anticoagulants is their specific effectiveness in arterial blood flow conditions. In venous circulation, where blood moves more slowly and clotting mechanisms differ significantly, conventional vitamin K antagonist anticoagulants demonstrate superior effectiveness. However, in the faster-moving arterial system where platelets play a dominant role in clot formation, antiplatelet drugs prove substantially more effective at preventing thrombotic events. This pharmacological distinction has shaped clinical practice, leading to different medication choices depending on whether a patient's risk involves arterial or venous thrombosis. Understanding this difference helps patients and healthcare providers appreciate why specific medications are selected for individual conditions. Primary mechanisms of platelet aggregation inhibition. Antiplatelet medications work through several distinct pharmacological pathways that each interrupt different stages of platelet activation and aggregation. Some agents target specific receptors on platelet surfaces, preventing the activation signals that trigger clumping behavior. Others interfere with chemical messengers that platelets use to communicate with each other. Still, other medications affect enzyme systems critical for platelet function. This diversity in mechanisms means that different antiplatelet drugs may work synergistically when used together, or that if one medication becomes ineffective, alternatives targeting different pathways may prove beneficial. The complexity of platelet biology allows for numerous intervention points, which has led to the development of multiple antiplatelet agents with varying potencies and therapeutic applications. Major classes of antiplatelet agents. Key points: cyclooxygenase inhibitors that reduce production of platelet-activating substances and are widely available and inexpensive. Adenosine diphosphate receptor antagonists that block critical signals required for platelet activation and aggregation. Phosphodiesterase inhibitors that elevate intracellular messengers that inhibit platelet function. Glycoprotein receptor antagonists that prevent the final common pathway of platelet clumping. Clinical applications in cardiovascular disease prevention. Antiplatelet medications have become cornerstones in the prevention and management of acute coronary syndromes, including heart attacks and unstable angina. Patients who have experienced a myocardial infarction benefit substantially from chronic antiplatelet therapy, which reduces the risk of recurrent events by preventing the reformation of clots within damaged coronary arteries. These medications are also essential following coronary stent placement, where they prevent the stent from becoming occluded by thrombus formation. The duration and intensity of antiplatelet therapy after stent placement depend on the type of stent used and individual patient risk factors. Additionally, antiplatelet drugs play preventive roles in patients with stable coronary artery disease, where they reduce the likelihood of atherosclerotic plaque rupture and subsequent thrombosis. Cerebrovascular applications and stroke prevention. Stroke prevention represents another major therapeutic arena for antiplatelet medications, particularly for patients with histories of transient ischemic attacks or prior ischemic strokes. These events frequently result from arterial clots that travel to cerebral vessels or form within carotid arteries, making antiplatelet therapy logically suited to their prevention. Patients who cannot tolerate anticoagulation due to bleeding risks or other contraindications often rely on antiplatelet agents as their primary thromboprophylaxis. The choice of specific antiplatelet agent may vary based on individual stroke subtypes, underlying vascular pathology, and patient comorbidities. Long-term antiplatelet therapy in secondary stroke prevention has demonstrated consistent benefits in reducing recurrent events and improving long-term neurological outcomes. Balancing efficacy with bleeding risk. A fundamental challenge in antiplatelet therapy involves achieving adequate thromboprophylaxis while minimizing bleeding complications. Because these medications interfere with normal hemostatic mechanisms, patients receiving antiplatelet therapy carry increased risks for hemorrhagic events ranging from minor bleeding to life-threatening intracranial hemorrhage. The bleeding risk varies significantly between different antiplatelet agents, with some having higher propensities for major bleeding than others. Clinicians must carefully evaluate individual patient factors including age, kidney function, prior bleeding history, concurrent medication use, and presence of structural bleeding risks when selecting antiplatelet agents and determining treatment duration. Regular monitoring and patient education about signs of abnormal bleeding become essential components of safe antiplatelet therapy management. Antiplatelet resistance and variable treatment response. Clinical practice has revealed that some patients exhibit suboptimal responses to antiplatelet medications despite appropriate dosing and adherence, a phenomenon termed antiplatelet resistance. This variable drug response may result from genetic factors affecting drug metabolism, the presence of specific disease states that increase platelet activation, inadequate medication adherence, or interactions with other pharmaceuticals. Identifying patients with antiplatelet resistance has important implications for treatment strategy, potentially prompting escalation to more intensive regimens or alternative medications. Laboratory testing to assess platelet function may help identify resistant patients, though the clinical utility of such testing remains debated among clinicians. Understanding the reasons for individual variations in antiplatelet response continues to drive research in personalized medicine approaches to thromboprophylaxis. Combination antiplatelet therapy strategies. Many clinical scenarios involve the simultaneous use of multiple antiplatelet agents, a strategy known as dual antiplatelet therapy, which provides enhanced antithrombotic protection. This approach is particularly valuable following acute coronary events and coronary stent placement, where dual therapy significantly reduces stent thrombosis and recurrent infarction compared to single-agent therapy. However, the combination strategy carries proportionally greater bleeding risks, necessitating careful consideration of treatment duration and individual patient factors. The optimal duration of dual antiplatelet therapy varies depending on stent type, clinical presentation, and bleeding risk stratification. Some patients require extended durations of dual therapy for maximal benefit, while others benefit from shorter courses to minimize hemorrhagic complications. Recent advances in drug-eluting stent technology and antiplatelet agent development have allowed for more personalized approaches to determining appropriate dual therapy durations. Special considerations in specific patient populations. Key points: elderly patients require careful dose adjustment and closer bleeding surveillance due to age-related changes in drug metabolism and increased baseline bleeding risks. Patients with renal impairment may accumulate certain antiplatelet agents and their metabolites, requiring dose modifications or alternative agent selection. Those with hepatic dysfunction may have impaired metabolism of some antiplatelet drugs, necessitating careful monitoring. Pregnancy considerations limit antiplatelet options, though some agents have established safety profiles during gestation. Future directions in antiplatelet pharmacotherapy. Ongoing research continues to refine antiplatelet therapy through development of novel agents with improved efficacy profiles and reduced bleeding risks. Emerging medications target previously unexploited pathways in platelet activation, offering potential advantages over existing therapies. Pharmacogenomic research aims to identify genetic markers predicting individual responses to antiplatelet medications, enabling personalized medicine approaches to drug selection and dosing. Advanced laboratory techniques for measuring platelet function may eventually allow clinicians to tailor antiplatelet therapy intensity to individual patient needs, potentially improving both efficacy and safety. Additionally, investigation into combination strategies involving antiplatelet agents with other antithrombotic mechanisms continues to expand treatment options for complex clinical scenarios. These advances promise to enhance the therapeutic benefit of antiplatelet medications while reducing the burden of adverse effects. Thank you for watching. For the full article, visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.